Greetings from UAP Old Mutual. Today is a very special day for us. Millions of people around the world are celebrating the World Kidney Day. And for today, we are going to have a webinar titled Living Well with Kidney Disease. And we are pleased to have Dr. Lallet Essaji, who's a consultant physician and nephrologist and also the Head of Renal Services at the Aga Khan Hospital Mombasa. She's going to be taking us through the presentation for today. My name is Dr. Elijah Matolo. I'm the Medical Practice Manager at UAP Insurance, and I'll be the moderator for the session. We'll have the presentation in the first half of the session, then thereafter we'll have a question and answer. So feel free to start typing in your questions. Karibu sana, Daktari.
Thank you very much, Dr. Matolo. I'm very happy to be here with you all. World Kidney Day is an event that as kidney specialists, we really celebrate, and all of this is in the hope that we can catch kidney disease early and treat it before it reaches end-stage kidney disease. And that is why we are very happy about this talk, because I'm sure you have some clients who actually might from this go for the screening camps which are held nationwide. Today Kenyatta is also holding a screening camp, Nairobi Hospital is holding, Aga Khan is also holding, which I talked about it in my letter in my presentation. So is it okay if we start the presentation?
Yes, we can begin.
Okay. All right. I'm also joined by my colleague, Janet. Janet is the head of marketing. At the end of it, she might, I don't think they can see me right now. Maybe at the end she can introduce herself. So living with kidney disease is actually the theme of this year's World Kidney Day. And it's about how to manage your kidney disease before it comes and after it comes. Before we talk about living with kidney disease, we have to understand the kidneys. The kidneys are actually are organs that are kidney shaped, and they are like bean shaped, and they are on both sides of our upper abdomen. They are connected to the bladder via ureter, and from the bladder, then the urine passes through the urethra. So they are very small. They are around 10 centimeters in length and 150 grams. Very small, but very clever organs, which we'll talk about it. So why are kidneys important? Because the kidneys have several roles. One is to ensure water balance. So the kidney is the one that decides you need more water in your body or you need less water in your body. Depending on your clinical status, it actually decides to retain water or to remove water. When the kidneys don't work, then you start retaining water, and that leads to swelling. The kidneys also help in blood pressure control. Most people don't know about that, that the kidneys help in blood pressure control. So you find patients who have blood pressure, high blood pressure, eventually leads to kidney damage, and the pressure becomes worse because now the kidneys are unable to control the high blood pressure. They also help in the removal of waste product through the urine. Urine is not just water, it's also waste product removal. So a lot of toxins are removed, and once they are not removed, you can get a lot of complications because of the accumulation of waste products. A lot of people don't know that the kidneys are very essential for bone health. And this is because the kidneys activate vitamin D. Vitamin D, you get it from sunlight, but it is in an inactive form, and when it does enter the body, it has to be activated by the kidneys before it can help in the absorption of calcium in your bones. So that's also a role that most people don't know about the kidneys. It helps with acid-base balance. Now, why is it very important? Because most of our enzymes are proteins, and proteins need to be in the ideal acidic alkaline environment for them to work well. So if the acidity increases or the alkalinity increases, then the enzymes don't work. The kidneys also help the heart in making them safe because they control some electrolytes. Electrolytes are salts like potassium, sodium, and calcium. And when your kidney fails, you can get high potassium levels, leading to cardiac arrhythmias, which can also lead to a cardiac arrest. Another thing that the kidney does is that it helps in producing blood. It doesn't make the blood itself, but it tells the bone marrow produce blood. And this is by sending out a signal from the kidney, which is in form of erythropoietin. It sends out a signal and tells the bone marrow you need to make blood. So you find those patients with kidney disease have low blood level, and this is because the erythropoietin, the signal, is not going to the bone marrow. So as much as they're very small organs, they're even smaller than the size of your palms, but they're very important and they're very smart. As nephrologists, we like to say the kidney is smarter than the brain. So when we look at the prevalence of kidney disease, it's very amazing that 850 million people worldwide have some form of kidney disease. They could be in mild kidney disease, or they could be in severe kidney disease, but 850 million worldwide is quite a huge number. If you compare it to diabetes, which is half the number, and you compare it with cancer, which is even less, 42 million, and if you compare it with HIV/AIDS, which is around 36 million, the people who are suffering from kidney disease are much, much more. Yet, if you look at it, everyone's talking about diabetes, everyone's talking about cancer, everyone's talking about HIV and AIDS, but very few people talk about the kidneys and the kidney health. And that is why we keep talking about the kidneys health and trying to diagnose these kidney problems early before it becomes too late. And on top of that, we have noted that worldwide there's an increase in the incidence of end-stage renal disease. If you look at 1990, we had only about 500,000, less than 500,000 people who are in end-stage renal disease. But in 2000, they increased, and by 2010, it had increased by 4 times the number. So you can imagine where we'll be at in the next 10, 15 years. We are going to have an increase in the number of patients with end-stage kidney disease, an increase in the number of patients on dialysis. And this is because we are seeing an increase in non-communicable diseases such as diabetes, heart problems. So we expect that the kidney cases are also going to increase. Now, some people might say that it's just around the eastern countries and the western countries, but not in Africa. But if you look at this study that was done, and it went through 12 countries, and it was a range of countries. You can see Africa was represented, Asia was represented, and that is basically our population, the type of population we have in Kenya. And we find that the chronic kidney disease prevalence is 14.3% of the general population. This goes up to 36.1% in high-risk population. So we are also just as much at a risk of kidney disease as the Western world. If you look at kidney disease as a cause of years of life lost, if you look in 1990, it stood at number 25, but then it started going up, and then it became number 21, the leading cause of years of life lost. And by 2015, it was at number 17, and this number is just going to increase, and soon we might be in the top 10 leading causes of years of life lost. So it's something we need to work on now and stop it now before it's too late. So someone will ask, who has a predisposition to getting kidney disease? So we always say we have the diabetes, the high blood pressure patients, the ones who have cardiac problems, the ones who are overweight. These are patients who are at a risk of getting kidney disease. There's also family history of kidney disease, tobacco use, and age. If you look at this, age and family and ethnicity is the only thing that you cannot modify, but the rest of the things are modifiable risk factors. That means you can quit smoking, you can control your sugar, you can control your blood pressure, you can control your heart problems and make sure that you don't lead to kidney damage. So that is why screening for kidney disease is very important. So some people come to me and say, have both my kidneys failed? Some people come to me and ask me, is this kidney damage forever? And they ask me, can't I revive my kidneys? So you need to understand that there are two types of kidney failure. There's the acute kidney failure and there's the chronic kidney failure. Acute kidney failure happens in people who have good kidneys baseline. They've never had any problems with their kidneys and it develops very rapidly. But there's a chance of recovery. That means this patient who has good sized kidneys, has not been damaged before, suddenly became unwell because of maybe an accident or some surgical procedure, or they used some drugs which caused them kidney failure, or they had an infection that led to kidney failure. So as long as your baseline kidney is okay, there's a chance of recovery. But again, as nephrologists, we are saying, yes, you will recover, but you will always be, it's like a car. You buy a new car and your car is working well, but the minute it gets the first accident, you know that car is not going to be the same later on. So it's the same with the kidney. It will recover, but there's always some loss of the kidney function that is there. And anytime you get unwell again, your kidney starts having problems easily. Then there's chronic damage. Chronic damage develops over years and it's irreversible. The problem in our health system is that most people come to the health care system very late. They've never screened for to see how their kidneys are working. They have diabetes, hypertension, they have not been diagnosed, or even if they have been diagnosed, they never go to the doctor and never control it well because the doctor is going to ask for tests and they don't want to spend money. So by the time they come with their kidney damage, it's too late. And that is why we always say prevention is better than cure, because by the time you come in end stage or chronic damage where your kidneys have shrunken, there's not much we can do, and we would have liked you to come earlier. So if you look at the prevalence of chronic kidney disease, it's around 10.4% among men and a bit higher among women, 11.8%. That is because women are predisposed to autoimmune conditions such as lupus, which lead to susceptibility to get kidney injury. Also, women during childbirth, sometimes some of them face complications. They get very high blood pressure, which actually damages the kidneys. Or some women get diabetes during pregnancy, and that also can lead to kidney damage. Now, in terms of acute kidney injury, it's experienced by 13.3 million people each year. Some of it resolves, some of it leads to chronic kidney damage, and some of it leads to end-stage renal disease. So again, I'd like to really emphasize that this is a vicious cycle. The acute kidney injury leading to the chronic kidney disease. So don't say, oh, figo yangu were damaged, lakini nili-recover. Never say that, because there's always a certain susceptibility you have to easy damage. And I tell my patients all the time that once you have got an acute kidney injury, anytime you go to a doctor, you must inform the doctor, I had a problem with my kidney, it recovered a bit. So that the doctor is very cautious with you also in terms of what drugs to give you, how to treat you. They are going to be much more cautious than somebody who doesn't mention that, because you might have a bit of your renal reserve might have been reduced. And together, this kidney injury, the acute and chronic, eventually leads to cardiovascular events such as myocardial infarction, that is a heart attack. It leads to end-stage kidney disease. It leads to a diminished and quality of life and disability and also death. So you want to be healthy, you want to be living a normal life, you want to be working. So it's always important to make sure that the acute does not progress to the chronic, and we don't get chronic in terms of risk factors if you have diabetes, hypertension, or you are actually in a family who have susceptibility to kidney injury. So stages of chronic kidney disease, we usually have 5 stages, and this is very important for you to know that in stage 1, the eGFR is estimated glomerular filtration rate. If you were to easily understand it, the eGFR, let's take it as a percentage. In stage 1, your kidneys are still working 90% or greater. And a lot of people would say, wow, my kidneys are working 90%. I don't have any kidney damage. But there's already some damage that is there. It might not be very evident in the kidney function test, but it might be evident in the urine. By stage 2, you are around 60 and 89%, still very mild damage. You are still feeling very well. You don't even know that you have a kidney problem. Then stage 3, you're still not feeling any problems. You are like, okay, my kidneys are okay, because you've never tested. If you do go and test, you'll find that your percentage of how much your kidneys are working, it has been reduced, but you still feel very well. And yet this time, most people are like, no, the doctor is lying. My kidneys are working fine. I don't feel a thing. And that is why the kidneys are silent killers. Kidneys only start showing symptoms when they reach below 20%. And that is the time you come in, you are like, oh, I feel very unwell. But it's too late, you are at stage 4. And what I'd like to say is, let us not come at this stage. Let us come at this stage, because this is where we can manage and we can give you a longer length of life with these kidneys. By this time, we're just looking for the inevitable. We are like, okay, by stage 4, I'm like thinking, how much can I make this kidney go? It's like having an old car, and you know the car is going to break down on you, and you're like, oh, let me push it. Let me just push it. And we are at this point, we are just pushing your kidneys. So come early and just follow with us, because this is very important. We can do much better when you come early than later. So like I said, initially the symptoms can be none, and that is why these kidneys are very dangerous, because there's the silent killers. But by the time you reach stage 4 and stage 5, now you notice that your urine output has reduced. You're getting fatigued and tired. You just don't have the strength anymore. You're feeling nauseated because of the buildup of toxins. There's swelling in the feet. Why? Because your urine output has reduced. So you start swelling on the feet, and eventually you start getting water retention in the lungs, leading to shortness of breath. You're not sleeping well because of the toxin buildup in your body. You have poor appetite. Sometimes some of them come with unexplained itchiness, because now you have toxins which are depositing on your skins. You have puffiness of the eyes and face, and you find yourself that your blood level has gone down, so you're feeling extremely tired, and just doing a few things is now causing you to be short of breath. So like I said, prevention is always better than cure, and prevention is screening. So we talk about screening. Screening means that we look to see if you have kidney disease. And what do? We screen your urine for proteins. Ideally would be a urine albumin creatinine ratio, and we do a blood test for creatinine. So we ask ourselves, who should be screened every year? One is if you have had a history of acute kidney injury, if you have diabetes, if you have hypertension, you have some cardiac diseases, you are above 60 years, you have some ethnic all susceptibility. And in ethnicity, we know that Indians have a higher risk of diabetes. African Americans have a higher risk of kidney disease. That has not really shown in our population. And Hispanics have a higher risk of kidney disease. If you're obese, you need to be screened. And if you have family history of kidney disease, the people who have something called polycystic kidney disease, which is a genetic kidney disease whereby they form multiple cysts and eventually it leads to kidney failure and requirement of dialysis or transplantation. So if you have a family history of kidney disease, you need to come and see a kidney specialist early. And we ask ourselves, who should be referred early? So anyone whose glomerular filtration rate is less than 30, that means your kidneys are working less than 30%. Or if you're already a chronic kidney disease patient with either a very high protein excretion in your urine, if your chronic kidney disease is of a known etiology, that means you're not diabetic, you're not hypertensive. At that point, if you come in early and your kidneys have not shrunken, we can do a kidney biopsy to find out what is going on with the kidney and then manage you appropriately. If you find that sudden increase of creatinine level, that is, and you have now your percentage of kidney function has declined by more than 25% in the last 4 months, you wonder why that rapid decline. If you have had any complications of chronic kidney disease, if you have persistent high potassium level, you need to come and see a kidney specialist because the high potassium level can lead to a cardiac arrest. If you have persistent blood in the urine. Recently, I got a patient, a young girl, who was treated multiple times for urine infection by my colleagues who are junior doctors. And I was sent and they said, this blood is not coming out of the urine. We have given her various antibiotics. And you'd realize that it makes such a difference to see a kidney specialist at that point because you can make a greater impact on that person. And the blood was not because of a urine infection. It was actually because of the kidney having a glomerulonephritis. So it's very important to come early when you have persistent blood in the urine. In fact, as long as you are not having your periods and you have blood in the urine, that is a no-go. You must come to the kidney specialist. If you have blood pressures that are becoming difficult to control, there might be some problems with your kidney, or you have recurrent kidney stones, or you have a family history of kidney disease. Now, in that regard, as I told you, we have World Kidney Day. The whole world celebrates World Kidney Day. And what we do is screening camps in different locations. As Aga Khan Hospital Mombasa, we have opted to do a screening camp in 3 centers. Last Saturday, we had a screening camp in Mombasa at the Aga Khan High School sports ground. We got around 76 people who came in, and I can tell you that we found a lot of kidney disease in those 76 people. We found a lot of urine infections. We found some people with unexplained blood in the urine. We are going to do the same in Kilifi tomorrow. So if you are around Kilifi, please come in. You're not going to pay anything. You're going to have a free blood pressure check, a free blood sugar test, a free urine dipstick. You're going to be weighed, and you get a free kidney specialist consultation and a free nutritionist consultation. So you're not going to pay anything. The most you'll do is use your energy to come to Aga Khan Medical Center, Kilifi. We are also going to Voi on the 20th. So I urge you, if you are around Kilifi, Voi, please come. You can book on this number 0415051000 and ask to be given a time slot. So please come and screen your kidneys. Now, we talk about how to have a healthy kidney. So ideally, remember, these are non-communicable disease that leads to kidney damage more often. So be fit and active. Eat a balanced diet, avoid refined foods. By refined foods, I mean white flour, refined meat like sausages. Drink adequate water, up to 3 liters of water in a day. Quit smoking. Make sure if you're diabetic, you have good control of your blood sugar, have good control of your blood pressure, and avoid over-the-counter prescription. So I find as Kenyans, we'd rather go to the pharmacist because pharmacist is daktari. Daktari will write for you, oh, I have this, give me some medicine. So as Kenyans, we find going to the pharmacist and asking for over-the-counter prescription is much easier for us than going to a doctor. And because of that, there's an increased use of non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs are painkillers such as diclofenac, aceclofenac, ibuprofen. All these drugs cause kidney damage. So you find people who come, they have some pains in the bodies and they've been using these drugs and they're coming with kidney failure just because they kept on using a lot of this medicine. The second thing we do is we use a lot of herbal medication. I mean, there's this notion that anything herbal is definitely safe. But if you look at it, if I were to prescribe your medicine, the people who have sat down, looked at the side effect profile, and by the time we are telling you this medicine, we know the side effects, but no one knows the side effects of herbal medication. And to add on to it, we find that in Africa, a lot of people get kidney damage because of herbal medication use. And this is because some of this herbal medication, apart from its own side effects that are unknown, people even tend to put some NSAIDs in them. So they might mix it with a bit of powder of diclofenac because, of course, when you go to a herbalist, you want to feel better. And the only way you're going to go back to the herbalist is if you feel much better very fast. So they do tend to use medications into the mixture, making you feel better fast, but worse in the long run. So avoid herbal medication use. In terms of nutrition, remember we have various kidney diseases. We don't have one size that fits all in terms of nutrition, and that is why it's very important to have a nutritionist advice. Let me give you an example of a diabetic patient. So initially when you have diabetes, we tell you don't eat the whites, don't eat white flour, don't eat white things, go for white brown bread, go for brown rice, go for anything brown. So a lot of people come to me once they are in kidney failure and they're like, I just eat brown, and now you're in kidney failure and I tell you, now brown is not good for you. So they get quite confused. They're like, but I was told white is not good, and now you're telling me white, that I should eat white. And that's because by the time you have kidney damage, you are unable to remove potassium from your body. You are unable to have, you are unable to balance phosphate in your body. So you end up having very high phosphate level, very high potassium level. So we now shift you to white. That is why you can say, oh, my friend went to a nutritionist and was told this is the diet for her. Should be the same diet for me. That is not true. If you have kidney disease, make sure you talk with your doctor. And if your doctor advises to go to see a nutritionist, please go. Now, treatment. Treatment again is tailored to the type of kidney disease and patient characteristics. Again, if somebody comes with a glomerulonephritis, they're leaking proteins, I will give them certain other medication. If somebody comes with diabetes, I'll make sure that the diabetes is well controlled. If somebody comes with blood pressure, high blood pressure, I'll make sure the blood pressure is controlled. If somebody comes with kidney failure, I may offer dialysis and transplantation to them. So it depends on what type of kidney disease you have, and we tailor it according to the type of kidney disease and what you can manage as a patient. Now let's talk about end-stage kidney disease. That is stage 5. Remember we told you stage 5 where your percent at which your kidney is working is less than 15%. At this point we might offer you dialysis. So what is dialysis? I must add that dialysis is not a cure, it's a bridging therapy. It's a bridging therapy to give you time to reach transplantation. So dialysis is a process whereby you have blood drawn from you via a catheter or a fistula. The blood then passes through a machine, that's your artificial kidney. It cleans up all your toxins, removes excess water, and after it has done all that, it returns the blood to your body again in a cleaner state. Now, remember, as we are sitting here, our kidneys are working 24/7. In a stage 5 kidney disease, your kidneys are not working. The National Hospital Insurance Fund offers dialysis twice a week to all patients. Twice a week, 4-hour session. Imagine we are doing 8 hours only in a week, and your kidneys, when they are doing well, they are working 24/7, 7 days a week. So you can never say that your kidney values will return to the way that a normal kidney should function. But what it does, it helps you tolerate your kidney disease better. It makes sure that it removes the fluid so you are not feeling short of breath, you are not swollen. It makes sure it removes some of the toxins. But ideally, like I said, this is a bridging therapy. Now, at the Aga Khan Hospital Mombasa, we have a renal unit, and we have just updated our machines to the new renal Surdal X dialysis machine. And we have noted that most of our patients are feeling much better. That has been taken with approval from our patient. And he actually has even done a video which talking about how well he feels on dialysis right now. So dialysis technology is updating itself. There are places where you might find that the technology has not updated itself. There are places where they don't look at the water quality. So make sure you dialyze at a good place where the toxins are free, the water is free of toxins. There's good dialysis machines, and there's adequate dialysis, and there are enough trained nurses in terms of dialysis care. Like I told you that dialysis is not a cure. Transplant is the only cure. So a lot of people come to me and have the notion that transplant is not a thing that we can do in Kenya. But I'd like to tell you that we do kidney transplant in Kenya. We have been doing it for a very long time, and our outcomes are quite good. Personally, I have worked in South Africa also, and I feel that our kidney transplant outcomes are much better than even South Africa. Our skills are quite well. The second thing people come and ask me is, so are my kidneys going to be removed, the ones that don't work? So that is why I put this picture up, that your kidneys, the ones which are sick, are still left there, and you are implanted another kidney in the iliac fossa. So iliac fossa is just above your pelvic bone. That is where your transplanted kidney rests. And you can even have, if this fails, you can have another kidney on the other side, and you can still be a person with 4 kidneys. The question that I'm asked again is, if somebody donates a kidney, are they going to be able to live with 1 kidney? And I like to say that yes, people can live with 1 kidney, just like a transplant patient, the one who receives the kidney, because his other 2 kidneys are not working, he's living on 1 kidney. The same with the donors, they can live with 1 kidney for a very long time. The third thing people ask me is about kidney care, and there's always this hesitancy about managing and doing kidney transplant in Kenya. People tend to want to go to India, and as much as I'm Indian, I'm not an Indian citizen. I'd like to say I'm Kenyan citizen, and I want to say that we are just as good as India. We might be cheaper in the long run. Imagine having to travel to India with a whole lot of family members, staying there for a longer time at the cost of transportation to India, at the cost of accommodation. We might be much cheaper doing kidney transplant in the long run here. The second thing, people think that Indian doctors are much better experienced, and that's not true. In Kenya, we do kidney transplant in Nairobi, we do in Eldoret, and all our centers have very good outcomes. The third thing people say is that follow up. They just don't seem to know where to go. And we'd like to say that we have nephrologists around Kenya, so you can follow up with kidney transplant. And in terms of, I'll talk about the kidney transplant clinic. Why are we really pushing for kidney transplant? Because studies have shown that people who undergo kidney transplant have a longer survival rate than those on dialysis. Now, in terms of kidney transplant, we have living donor and deceased donor. Living donor is somebody who's alive and has opted to give you a kidney. So we just take one kidney from that person who is very healthy. We don't take a kidney from somebody who is unhealthy and who will require both his kidneys. So the process of screening, the process of preparing you for a transplant includes making sure that the person who's giving you is not going to need the kidney later on. Deceased donor is whereby somebody dies and his family or he himself before death had opted to give out his organs for organ transplantation. Now in Kenya, we don't do deceased donor kidney transplant yet. That was because it was not in our health bill. But currently we are working towards it, and it has been, soon we are going to have a deceased donor program whereby people can opt to give their organs after death to help people in need. Now, dialysis patients, if you look at the 10-year survival, you can see it's barely 20%. And look at the living donor transplantation, it's 52%. So you have a better chance of surviving, of living a healthy, normal life than people on dialysis. So I urge you all, do transplant, don't delay. This is again a graphic representation of people. If you had 100% people who started treatment at the same time, one group went on dialysis and one group went on transplant, you find by year 10, the people on dialysis will have less than 10%, but the people on kidney transplant will still be alive, around 75% will still be alive and doing well. So again, kidney transplant is the cure to kidney disease, not dialysis. A lot of people come and tell me, but kidney transplant is so expensive. And I tell them, how is it expensive? If you look at dialysis per session, it's around 8,000 to 9,000. In 5 years' time, you have used 4.3 million because you're doing 8 sessions in a month. This is just the dialysis. We are not talking about the catheters that you keep needing to change. We are not talking about the fistula that you need to do. We are not talking about the infections that keep on recurring and you end up having to get admitted for infections. We are not talking about the strain on the heart that you are having because your kidney disease is still going on and your heart is quite strained. You are at risk of at higher risk of cardiac diseases. I'm just talking about just dialysis is reaching 4.3 million. But people tend to look at transplant and say, transplant is very expensive, 1.6 to 2.5 M. And then the drugs are expensive. And it's true, the drugs are expensive, but as Kenya Renal Association, us the nephrologists in the country, we're really trying to reach out to NHIF to make these drugs affordable to people. Just as they are sponsoring dialysis, we're also asking them, could they make post-transplant drugs cheaper? Could they give us more support in terms of kidney transplant? Currently, NHIF pays around 500,000 for your kidney transplant if it is done in a private facility. If it is done in a public facility, it actually covers the full cost. But if you look at 5 years down the line, having taken into account all the drugs you have used and the kidney transplant procedure, 5 years down the line, we are still much cheaper. The cost is much cheaper. But what has changed is that you are able to go to work. You are able to live a normal life. Females are able to conceive. Male are also able to have children. In dialysis, you are unable to conceive. So you are able to live a normal, healthy life. You are able to work. You are going to get income. The income that was not possible before. So we urge you, please consider transplantation. Now, in that regards, we have started a kidney transplant clinic at the Aga Khan Hospital Mombasa, which is every Wednesday from 10 a.m. to 3 p.m. We do the pre-transplant counseling for the family members and the patient. And that's because most of my patients find it very hard to talk with their family about asking for kidney. It's a very hard conversation to have. And I urge my patients not to have it by themselves. I say it's easier from my side if I give facts about kidney transplant rather than you trying to ask. So I always tell them, come, let's have a talk as a family member with you there. We also do pre-transplant workup for the donor and recipient, and we refer you to an appropriate center because currently Mombasa does not do kidney transplant, but the public sector as well as the private sector are thinking about starting a kidney transplant program in Mombasa. However, it will take time, and currently we refer you either to Nairobi and Eldoret to do your transplant there. Then after the transplant, we urge you not to be lost. Come for post-transplant follow-up because in the first year you need a lot of follow-up. Then when you become a bit stabilized, we decrease the number of visits that you the visits to the kidney specialist. If we look at global distribution of nephrologists, and that is per million population, you find that Kenya, we are not doing so well. We are still very low in terms of the number of nephrologists per million population, and most of them are concentrated in Nairobi. But Mombasa has 5 nephrologists, and that is, we are actually fortunate to have 5 nephrologists in Mombasa. But that doesn't mean that we shouldn't go to the nephrologist. Do go to the nephrologist, even if it's in Eldoret, Kisumu, Nairobi, or Mombasa. Please make a point of going to the nephrologist. Most of the Aga Khan centers have a nephrologist available. That is why we say, why Aga Khan Hospital Mombasa? That's because I'm here full time. You can come any day. Even if I'm not physically in the hospital, I'm always available on phone. We run daily kidney clinics from Monday to Friday, 10 to 3. We have clinics on appointment basis on Saturday, and we have a transplant clinic on Wednesday. That is all from me. Thank you very much. We, as Aga Khan Hospital Mombasa, were very happy to have had this opportunity to talk about our kidneys that are our hearts. Basically, the kidney is our heart.
Thanks a lot for that very wonderful presentation. We'll just jump into the Q&A session immediately, and we'll start with the first question from one of our attendees. So the question is, can kidneys be affected if we take too much water than the recommended amounts?
So remember I said that kidneys are smart organs that control the electrolytes, which are salts, and they have potassium and they have sodium. So if you take too much water, you might find that you have very low sodium levels and very low potassium levels, which eventually might cause a bit of other problems. Not necessarily the kidney, but the low potassium and low sodium can cause issues. So yes, don't take too much water. Don't drink 4 to 5 liters of water.
Thank you. A question here. There are cases where one sits down for too long, the legs start swelling. Is that an indicator of kidney disease?
So there are various reasons for leg swelling, not just the kidney. There are cardiac causes of leg swelling. There's also a venous insufficiency where you sit a long time, and because your veins are not working well, you end up getting swelling of the legs. But we can only say that after we have examined you and ruled out any other thing before we can make such a conclusion. So we urge you, if you have swelling, be seen by a doctor. Even if it's venous insufficiency, there are things that need to be done, like compression stockings that you need to get. Maybe you are overweight, you need to maybe lose a bit of weight. And those are things that we will advise you according to what is causing the swelling.
Okay, thank you. What could be the cause of recurrent UTIs, and what is the ideal treatment? And does it mean that the kidneys are not functioning well if you have persistent UTIs?
So, what is the cause of recurrent UTI? So, any male person who gets a urine infection, we start worrying. Why is a male person having a urine infection? Because the male anatomy is such that the holes are not very close together. A woman tends to get a bit of more infections because the urine, the place where the urine passes and the place where the feces pass are very close together. So women can tend to get more urine infection. But recurrent urinary infection is very concerning to us because we want to know, is there some obstruction in your pathway that is causing a lot of stagnation of the urine? So we urge you, if you have recurrent urine infection, please come to the kidney doctor.
Thank you. What's your take on the green veggies juice people use to detox?
The green veggies. Remember, if you have kidney failure, potassium is a problem to you, and high potassium can cause cardiac problems. So unless you have very good functioning kidneys, you shouldn't be taking those green smoothies.
Thanks a lot for that. Is there anything like drinking too much water? If yes, how do I know that I'm taking too much, and how does it affect my health?
Depends on how much are you taking. Up to 2 liters is all right. Up to 3 liters is all right. But above that, it's too much.
Okay, thank you. Does herbal include taking ginger and garlic concoctions? That I think it was a reference to herbal medications.
Let me just give an example of my mom. My mom is diabetic, and she's started cinnamon. And cinnamon is quite easy to have, yeah. I mean, we don't know of any side effect that it has, but you know, my mom started having a lot of acidity, and she blamed it on the drugs that she was having, because that's easier to blame. It's always easy to blame the artificial drugs than the herbal medication. Only to realize it was the cinnamon that was causing a lot of acidity and reflux. So everything has a bit of issues. What I say, ginger can cause a lot of blood thinning, and it can cause a lot of blood loss if you are susceptible to have very thin blood. So how much ginger are you taking? Everything in moderation. I'm an Indian. We take ginger, turmeric, garlic, so much of it, yeah. But if you are using it as the only source of your medication and you're taking a lot of it, then it's not good.
Okay, thank you. There's a question here. Can drinking water late at night affect your kidneys? And another one, drinking salty water, does it affect your kidneys? And is it advisable to use it?
Drinking water late at night should not be really affect your kidneys as long as you are urinating well. So I don't think that is a problem. But drinking salty water is definitely a problem. One of the things is, how are you able to drink salty water? That's very hard. Second thing is, salt intake, increased salt intake leads to hypertension. Hypertension will lead to kidney injury. It will lead to a lot of cardiac problems. So I wouldn't advise somebody to take salty water.
Thank you. So a question here about a child who suffered severe UTI at an early age, around 1 year. Are they at risk of developing acute kidney injury or kidney issues later in life?
So again, why severe urinary infection in a child? A lot of kids have children have some anatomical problems whereby they have a lot of reflux of the urine back to the kidneys, and that can cause damage. So my question is, what was the cause of the UTI? Was it just a normal urine infection, or was there something that was happening? Now, if it is not a recurrent urinary tract infection, then we might say maybe we are all right. But if it's a recurrent urinary tract infection and there's problems with the urethral valves, then you might have to undergo some surgery to correct it. Otherwise, you might end up in kidney failure. And a lot of kids have anatomical, the anatomy of their urinary tract infection is a problem, and they get a lot of recurrent infection, which leads to kidney damage.
Thank you. What causes kidney stones?
So kidney stones, there are risk factors for kidney stones. One is poor water intake. Remember, this is a flushing system. If you drink very little water, most of your toxins are going to stagnate. Remember, we did physics, and when we were doing crystallization, we used to put a small crystal and then it would become a big crystal overnight. So the same way, a small crystal can become a big crystal because of stagnation, because there's no cleansing. It's just they are stagnated. So poor water intake can be a cause. A very high calcium diet, a very high protein diet, which can lead to uric acid stone formation. People who are diabetic are at a high risk of kidney stones. So those are the things we look at when we assess kidney stone formation in most of our clients.
Thank you. Another question here. Now you highlighted it briefly, but question is roughly how much does it cost to do a kidney transplant in Kenya at the moment? And secondly, the anti-rejection drugs post-transplant require about 40,000 shillings per month. Does the medication cost reduce gradually or is it constant?
Yes, so kidney transplant process, the surgery itself costs anything between 1.6 million to 2.5 million. That depends on where you are doing it, and that depends on how complicated your case is going to be. The second thing is, remember that is the total cost. NHIF pays around 500,000 Kenya shillings to you, so you are removing that from the total cost. Before you go for kidney transplant, you need some blood test for you and your donor, which costs around 300,000 Kenya shillings. After transplant, initially you are on very high medications, which cost around 40,000 per month, but gradually they are reduced and eventually it comes to around 15,000. Now, if you tell me that kidney transplant drugs are a bit not affordable, there are always ways in which you can work around it. Kenyatta National Hospital has subsidized rates for kidney transplant drugs, and we have sent a lot of our patients to Kenyatta National Hospital to get the drugs at the subsidized rates. So if you look at in terms of the cost of kidney transplant and you look at the quality of life, eventually you'll be able to work, and eventually this is going to help you in terms of managing your cost, rather than having just dialysis and you're not working and you're just using money that your family is getting strained about.
Thank you. And I think just to mention, I think at some point, the cost of a transplant at KNH was around 600,000, and NHIF would take care of a big chunk of that cost. So it's just something then that we can always compile and share the cost for those who are interested. A question around what is the lifespan of a transplant patient? And the other question is there any difference for the lifespan of the donor?
So that's a very good question. And that's something I'm very passionate about, donor and kidney transplant. So a lot of people feel that by giving out your kidney, you're going to have a lower length of life, or you're going to be more sick, or you're going to have a lot of problems, but that's not true. There are studies done that showed that the donors are not at any higher risk of any diseases than the normal population. So just like I have a risk of developing diabetes, I have a risk of developing hypertension, that's the same risk you have in the kidney donors. And on top of that, sometimes they're saying that the donors are actually more healthy, because now that I know that I have one kidney, I'm going to be more cautious about what I eat. I'm going to be very cautious about my lifestyle. I'm going to be very cautious about exercise. So you end up being more healthy than the person who is in the general population. The second thing is the lifespan of a kidney. So we cannot, everyone has different patient characteristics. The people who are going to have a kidney transplant but not take drugs, never follow up. I recently had a patient who went for kidney transplant, after some years decided to stop taking the drugs just by himself. Of course, the kidney failed. So we cannot say that it's the kidney's fault. It's actually the patient's fault. I recently had, I've had patients who are living with kidney transplant above 30 years, very healthy, working, doing well. So we cannot say that one kidney survives this long. However, a study has been done recently in South Africa, and they looked at average survival rate. So by survival rate, they looked at the person who has a kidney transplant and the person who is on dialysis. And the average survival rate was 5% in dialysis, 5 years in dialysis, and the average survival rate on transplant was 12 years. But remember, this is an average. We have people who are on the higher, they can live to 30, 40 years on that transplant, and we have people who will, the transplant will barely last a year. This is because they were not very proactive with their drugs, or they stopped their medication, or something happened. I mean, somebody can get an accident also. So kidney transplant gives you a longer length of life compared to dialysis.
Thank you. So what are some of the causes for a kidney transplant to fail?
So one of the most important cause is non-compliance. That means you don't take your medication. Then, because remember, we are giving you medicine to stop the kidney from rejecting, because this is not your own body tissue. Your body is very smart; it can recognize your body tissues. So we make sure that your immune system does not recognize this as a foreign object. When you don't take your medication, then you can get something called an acute rejection, whereby your body fights it. If you don't take your medication, you can go into chronic rejection. Again, remember, you have your first kidney failed because of diabetes or blood pressure or an inflammatory kidney inflammatory disease. The same can still happen to your kidneys. But most of the time, it's either an acute rejection or, again, an acute kidney injury that is not managed in well or not managed in time, leading to permanent damage of the kidneys. So I would say any fluid loss which is excessive, acute rejection, chronic rejection, and whatever was native to your kidneys that damaged it, like the diabetes, hypertension, can also damage your kidney.
Okay, thank you. We have a question here. If I have hypertension and I am on medication and my blood pressure is well controlled and stable over a prolonged period, do I still have a high risk of kidney disease?
So as long as you're hypertensive, you always have a higher risk of kidney disease. And that is why we tell you, then the general population who does not have hypertension. And that is why we always tell you, make sure your blood pressure is well controlled. Make sure that you are seen at least once a year by the kidney specialist in terms of your urine, your kidney function test. Because the kidney, remember when I talked about the 5 stages of kidney disease, before it starts showing in your blood, it's going to start showing in your urine. And that is the time to act. So that if you have to change anything, your blood pressure might be controlled, but maybe you might need to adjust your medication to help your kidneys. So that is why we say at least have once a year checkup of your kidneys in terms of your urine and your creatinine levels.
Apart from dialysis and transplant, is there any research that shows medications that can be used for treatment or will be available to treat the like a kidney? I think this is a kidney disease, end-stage kidney disease.
So for now, we don't have anything else. There are artificial kidneys that are being developed in the sense that an apparatus that would work the same way as dialysis and help and you could attach it to your body and do the same work, but they are not yet in the market. But that is what the whole world is going towards. Hopefully it will come. I'm not yet sure when it will come. It's been some years and it has not yet come. Maybe in a few years when we have technology, we are a fast-paced technology world, I'm sure they will find a solution.
Thank you. Very interesting question here. So you mentioned that one should avoid smoking, but you left alcohol. So then another question, what is the effect of buildup of uric acid?
Okay, so alcohol predisposes you to a lot of non-communicable diseases. It predisposes you to cardiac issues, liver issues. It predisposes you to liver failure, and that consequently leads to kidney damage. You see, so alcohol again. I'm a Muslim, so us we say no alcohol, but they say 1 unit. So a lot of people come and say, I just take 1 bottle of whiskey. That is not 1 unit. 1 unit is um, 1 tot of whiskey is 1 unit, or 1 unit of vodka is a tot of it. Yeah, you can say that I've drunk a whole 750 ml. It's just 1 unit, so that's not true. Then a lot of people say if it is 1 unit in 7 days, then I can do a whole 7 days in one day. That doesn't work also. Yeah, so be very sure that 1 unit is 1 unit. Don't go overboard and say I've done 1 unit in the whole 7 units in one day. So be careful about that, because ultimately it can lead to your kidney damage, not because directly but indirectly. The second question was about the buildup of acid. So like I told you, a lot of our proteins and enzymes work at certain acidity alkalinity level. So when there's buildup of acid, those proteins will not work, and because of that you can get a lot of issues.
Yeah, the question was actually uric acid.
Okay, so uric acid can cause gout. It can also lead to kidney damage, and high uric acid is also a high risk factor for cardiac diseases. So high uric acid can also cause damage. And remember, high uric acid, for you to treat it, then you need painkiller, because you are so much in pain that the first thing you go is get painkillers like diclofenac, aceclofenac, which I said that are that cause a lot of kidney damage. So uric acid can eventually lead to kidney failure because of the pain medication you use. Maybe they affect the heart and cause the kidney failure. So controlling your uric acid level, making sure you are on a very low protein diet, and if need be, you are on medication to lower your uric acid.
Thank you. Is there an age beyond which kidney transplant cannot be done?
So when we look at a kidney transplant and age, we are trying to look at how beneficial is this kidney going to be on a person. So most centers, they say a cutoff of 65 years of age, because imagine when we look at our estimated average years of life, and you look that a person has passed that average years of life, and you think, will this person benefit from taking a kidney from somebody? How much are we prolonging? So most centers, we say 65 years of age and below, we for them to have a kidney transplant, because it's going to increase their life. But if you come a 90-year-old, I will not transplant you, because there's no benefit you're adding. You have already lived a good life, and we do not want to compromise the life of somebody who has donated a kidney to prolong it for 2 years or 3.
Thanks for that. Can daily intake of multivitamin tablets affect your kidney function?
Generally, no. If you say that those are good multivitamins, they are from authorized places, then it shouldn't affect your kidney function. However, if you're young and you're eating a very good diet, you might not even need the multivitamins. If you're older, you might need the multivitamins. If your doctor has prescribed it to you, then you can take. But if you're young, I would rather you eat a better diet than eat multivitamins.
Okay, thank you. For people with underlying conditions such as diabetes and hypertension, would it be advisable for them to undergo dialysis or a kidney transplant?
So, if your kidney failure is diagnosed early, and we say you are in end-stage kidney disease, but you are not requiring dialysis, like you are not in an emergency state where you require dialysis, then we work you up as a preemptive renal transplant. What a preemptive means is that we are transplanting you before the onset of dialysis. And a lot of us, that is what we want. Because remember, putting dialysis catheters, which are in the neck, or multiple dialysis catheters, are a source of infection. In a diabetic patient, that is also a source of infection. So if we can manage and transplant you before requiring dialysis, then you are our optimal patient. However, some patients, by the time they come, they are at a point where they are having a lot of symptoms. They are in fluid overload, their lungs have water in it, and we have to dialyze you as we try and work you up for kidney transplant. But ideally, if you come in early and we see your glomerular filtration rate going down, and we estimate that in the next 1 year you will be on dialysis, we tell you to start looking for kidney transplant and work up at that point, so that you don't need to go to dialysis.
What are the options for a 79-year-old who has kidney failure?
Unfortunately, for a 79-year-old, we'll probably be just thinking about dialysis. But if they need dialysis, you might be telling me kidney failure, but they've not reached the end stage kidney failure. Maybe they're in stage 4. If they're in stage 4, we say we're going to let those kidneys work as much as they can till when they are unable to do so, or when there are symptoms or some emergencies or fluid overload or very high potassium level or very high acid level in your body, then we will advise dialysis. But if you are not really requiring dialysis and you are managing well, you have good urine output, we will still hold you closely to us. We'll monitor you very closely. We'll tell you anytime something happens, come to us, because we want to make sure those kidneys don't deteriorate further, and we can keep you off dialysis for as long as possible.
And at the point where your legs are said to be swelling and retaining water, does it also mean that the entire body is generally retaining water?
Yes, that is very true. So when your legs start swelling, that's an easier place because gravity pulls it down. Eventually it starts, because now there's a limit to how much your legs can swell, so the water has to find another place to go in. So it starts accumulating in other organs. The lungs are the easy targets. And then soon after you start getting shortness of breath, you are huffing and puffing away, and you can't lie flat because your lungs have water. So yes, swelling of the legs eventually means uh, water retention in other parts of the body.
Is there such a diagnosis as a chronic UTI?
So that is why I say, um, you see, you can say a chronic UTI. You find out why is the patient having a chronic UTI. What is causing the chronic UTI? Is there some obstruction? Maybe there's some narrowing of the ureter or the urethra, and maybe just by dilating that place, we might not get infection. So it's very important to know why that is happening and what can be done about it. And only that you say, and then what do you mean by chronic UTI? It's like my patient coming in the other day, and they kept saying, no, there's UTI, and it was actually blood in the urine. It was not a UTI. So I would be very hesitant to label something a chronic UTI unless I had the facts that what's causing them to label it as a UTI. Sometimes what happens is the antibiotic that we are using is not working. There's a bacterial resistance to that antibiotic. So people don't tend to do urine cultures. And when the urine culture comes out, you find that the antibiotic you're using is not appropriate to that specific bacteria, and you need something else. So I would be very hesitant to label something a chronic UTI without looking into why you have a chronic UTI.
Thank you. There's a question here: is kidney failure hereditary?
So there is a genetic predisposition. For example, there's polycystic kidney failure, whereby people have a genetic predisposition to forming cysts in their kidney, and because the cysts continue growing bigger and multiple start forming, then your kidneys are squashed. You are unable to use your kidneys well. So there is genetic predisposition to some kidney disease. There are some other genetic kidney diseases like Alport syndrome. There is a genetic predisposition to have the APOL1 gene, but at the same time, there's also other things like diabetes, hypertension. Now, diabetes, hypertension type 2, it's because of your family, the way you have your eating habits, your sedentary lifestyle. So I am used to a place where now you are always eating a lot of starch and sugar. So your mom always prepares starch and sugar. We are eventually at a higher risk of developing diabetes because of the environment you live in. Not really because of the genetic predisposition, but because of the environment you live in. So you find that in your family you have diabetes because of the type of lifestyle you have. So there is a bit of genetics in it, but not always.
Okay, and how come that I think it's a concern from one of our members? How come young people have more kidney issues than before? Is there such a thing?
Um, okay, one, let's talk about diagnosis. a lot of people are being diagnosed. Before, some people were not getting diagnosed and just dying. Second thing, we look at the effect of the westernization on on us. We are finding people are much more they're no longer following a proper healthy diet. People are smoking more, young people are smoking more, so they are having some kidney issues because of that. We look at so our lifestyle, we are more stressed, so there's a bit of oxidative injury, we are less fit. Then we look at the medications. People never used to take a lot of medications in terms of painkillers. Our younger generation opt to go to the pharmacy and just take painkillers without a prescription. So those are the things that are influencing how there's a rise in kidney diseases among the young people, rather than just and then young people are very difficult. Imagine a child who has diabetes, they are really going to have difficulty controlling their diet. There's always that child doesn't want to do because it's very hard for them. So a lot of people who are diabetic in young age and poorly controlled end up with kidney failure. And it's part of it because they've not been managed well for those things. So those are the things that are factoring in into our high prevalence now. But generally, we still have the older people having more kidney failure than the younger people. For the moment, it's still the older people having it more.
Can chewing stones lead to kidney stones for pregnant mothers?
So we see why is the person having the need to chew stones. So a lot of times you find that they have some deficiency in calcium and the body is trying to look for that in other ways of getting the calcium in the body or some other minerals. So ideally it's best to correct the underlying deficiency in the minerals rather than chewing stones.
Thank you. Are there any recommended ways to detox?
Not from the kidney perspective, because I mean people have these different plans, these different things they use for detox. Again, these detox things, some solutions they have that we don't know what is causing it. A proper, healthy, balanced diet is much better in the long run than a 3-day detox. You have not done yourself any favor because you go back to the same habits afterwards. So I would rather a proper, healthy, balanced diet than a detox.
Should I be worried when I pass colored urine, especially in the morning?
Depends on what color it is. Is it red? Is it dark orange? It is a worry. You should get a urine checked because it might be it might be an infection, it might be you're taking very less fluid, or it could also be that you have some blood in your urine. So a urinalysis will tell you that.
So, question here. You've talked about avoiding taking painkillers, but that's not possible for women, especially for the ones with painful cramps and other conditions like endometriosis.
So they are safer painkillers. Panadol is quite safe for the kidney, and generally, if you have Panadol, I would prefer you having Panadol, but of course, don't overdose on Panadol because it can also cause liver injury. Second thing, it's always best to deal with the reason that you are having the pain. So if you have endometriosis, see your gyno. Second thing, if you have painful menstruation cramps, you can get other types of medication like Buscopan, Nospa, that can also help in terms of the pain. If your pain is so severe, we can opt to give you other medications that are stronger a bit, but it's always good to know why the pain is happening and what you can do about it before just taking medicine.
Okay, and does taking lifelong medications cause kidney failure in the long run?
So that depends on what medication you mean. Are you telling me that you have diabetes and you have to take lifelong medication? Sorry. If you're having diabetes and you don't take your medication, you'll end up in kidney failure. But sorry. But if you are having pain and you're taking lifelong medication, then you'll have kidney failure. So it depends why. And some drugs, as much as they have side effects, you need it, otherwise you are going to have other issues that are going to kill you faster than taking the medication. So it's very important to take your medication as prescribed if needed.
Okay, thank you. Is there a limited number of times that one can do a transplant?
So there's not a limited number of times that one can do transplant. Remember I told you you can even have 4 kidneys in your body. You can even go much more than that. But the question is, why are your transplants failing? That is the biggest question. Is it a problem with the adherence to medication that is causing the kidney failure? Or is it inadequate follow-up? Or is it poor management of the first thing that caused your kidney failure in terms of diabetes and hypertension that is leading to kidney failure? So I would ask you, what is causing your kidney failure?
Okay, I think there's a question here. Someone asking, what's the ideal color of urine? If you could just describe it.
So the ideal color of urine is straw colored. It should be clear. It should not be cloudy. It should not have any particles in it. It should not be foamy. So a straw colored urine is the best ideal color of the urine. But not only that, we look at other things in the urine. We look at proteins, we look at blood that you might not see with your naked eye. That is only seen when we do a urinalysis and we see it under the microscope.
Okay, and what would cause swelling of the feet 1 year after a transplant? And another question, how bad are bananas to kidney failure patients?
So what would cause swelling of the feet is that one, you're having a recurrence of kidney failure. Second, it could be because of your heart, so your heart needs to be checked. Third, it could be just venous insufficiency also. So basically, you need to be checked and seen why. Just like any person who walks in and has leg swelling, there are certain things that I'm going to ask for. Those are the same things we would ask for. Now, bananas are very bad for kidney failure patients. I mean, we say don't eat bananas because they have very high potassium levels. And remember, kidney person doesn't remove potassium from the body because they are not making urine, and they can get very high potassium levels, leading to heart attacks and cardiac arrest.
Is there any effect for drinking lemon water every day?
So, if you look at it, lemon water is very acidic, yeah? You can get a lot of hyperacidity because of drinking lemon water. So you might start having ulcers because of that. It doesn't really necessarily affect the kidneys. Sometimes a lot of vitamin C intake can increase your calcium, your stone formation. So it might give you a high risk of kidney stones. Directly, it might not, but indirectly, it might cause damage to your kidneys.
Okay, thank you. I think we're really out of time, so I'll just take the last question, and it's around taking salt. So, what is your take on adding salt on already cooked and served food? You know, like the way people add salt on either boiled eggs, some without even tasting. And is there anything like a recommended serving amount per serving?
Can I tell you that if I am ever in a restaurant and you are seated beside me and you do that, I just cannot stop but tell you. Like, it's just something that I have to tell you. Like, it really, when you just cannot keep quiet, that is what I do. Like, if I see you putting salt on your food, I just like start telling you that you can cause hypertension and damages to your kidney. Ideally, all food have a salt content. Even food that you have not put salt in, like let's say if I was to make um, stew today, and I just look at the vegetables I put in, they all have salt in it. So that, in fact, there are some places in in the world, the tribes don't put any salt, and you find that they have very low risk of hypertension. So low salt diet is very important generally. Don't put salt more on top of that, because the person cooking has already put salt, and then you're just adding salt. We are, as a community, we are very much in that habit of putting salt, but just cut down. If you cut down a bit today, you find yourself cutting down, and eventually, when you start putting salt, you find that that person will tell the person, "Oh, your food is very salty." So it's a habit you have to nurture.
Yes, so and I think the other advice is, especially for in your homes, ensure you throw away all your salt shakers. That's the number one way to make sure that you don't add any additional salt to your food. Yeah, I think we've come to the end, so we'll just ask Daktari, you can give your final remarks as we close the session.
All I have to say is thank you for this opportunity. I can introduce my marketing manager now. I think she wasn't visible at that time. Her name is Janet, and I think I've talked enough now.
Good evening, how are you? Can you see me?
Yes.
Yeah, this was a very interesting session. We are grateful we had this session. Anytime you want us to do more topics, you can let us know, and we also do the same. If you want more of your questions to be answered, you can still send us, I don't know, Dr. Matolo, if you have my email address, you can forward it to Dr. Essaji, which should be able to address all the questions that come up.
Yeah, you can share your contacts.
Thank you very much.
Okay, thanks a lot. We've come to the end of our session today. I think it was quite an interesting topic. I know now we all know how to take better care of our kidneys and ensure that we live our entire lives without ever requiring to either get a transplant or just living a long and healthy life. Thanks a lot to the Aga Khan Hospital Mombasa team. We really appreciate, and thanks a lot to the entire clients for UAP. Thanks for joining us for this session. We really appreciate your continuous support. Thank you and have a lovely afternoon.